The Contracts Division came up with several different innovations that allowed us to receive this award. The most important is that we've become a one-stop shop for contracts.
We've built a Contracts Division that is responsible for three things: reducing external legal costs, increasing customer satisfaction, and reducing legal risks for the organization across the entire system.
The idea for the Contracts Division and the centralization of contracts was developed several years ago in the St. Louis network.
We took that model and expanded it for the entire system, for Missouri, Oklahoma, Illinois, and Wisconsin.
Before we centralized contracts to the corporate office here, all the contracts were handled separately at each SSM hospital or entity. And there were a lot of inconsistencies in how things were managed.
We are able to take every contract that the system needs through every cycle, from the approval to the request, to the drafting, to the review, and the administration and auditing of contracts to ensure that we're in compliance with all federal and state regulations and all of the internal policies and procedures that we have at SSM Healthcare.
We even send contracts electronically to executives to sign. It's instantaneous. So we've reduced the turnaround time by a few days just by implementing a new process for executives to sign things right on their computer.
We've been able to drop contract review turnaround time from 7 or 8 business days about a year ago to now we're processing things usually, if not 2 business days, the same business day.
Another great result is that we have standard operating procedures and templates that's uniform across the entire system.
We used to spend about $100,000 a month just related to negotiating contracts and reviewing contracts. And through this new process, we've been able to almost completely eliminate that, where now, any month, it may be $1,000 or less.
By coming together as a networked or a system-wide contracts division, we've been able to achieve significant cost savings just by renegotiating rates with the same vendors that we have.
The processes that we have in place here really reflect and help facilitate the mission of SSM, because we want there to be exceptional healthcare services, and contracts are a big part of that.
Our mission is to deliver quality healthcare services, and I really think that this has gone a long way in helping us do that.
I'm so excited about the Contracts Division. I'm so proud of the team that we've established. We are looking into various ways to expand what we're doing and providing better service at a lower cost.